All right, good afternoon. Welcome to the House Health Committee. We are on voting list number 10. It is Friday, March the 20th, and we're going to get started with our withdrawals. Do we have a motion on the withdrawals? All right, it's been moved and seconded. Any further discussion on the withdrawals? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, House Bill 598. This is physicians licensing internationally trained physicians. This is Lindsay Ann Rosenberg.
This bill authorizes the Maryland Board of Physicians beginning October 1st, 2028 to issue a limited license to practice medicine to a physician licensed in a country other than the United States, its territories or possessions, or Canada who meet specified requirements. The term of the license may not exceed 3 years and the license may not be renewed. The amendments that begin on page 1 in packet 1 establish qualifications for the limited license, require the board to report to committees, General Assembly committees on the status of preparations to begin accepting applications, and establishes the intent of the General Assembly that the board consult with stakeholders on developing policies and regulations.
Delegate Rosenberg.
It was a party line vote in the committee, in the subcommittee, excuse me, and Delegate Hill negotiated the agreement on the amendments.
Would you like to move the amendments?
Move the amendments.
All right, amendments have been moved and seconded. Is there further discussion on the amendments?
Yes.
Oh. Delegate Tavera.
Yes. Delegate Hill, were you able to speak with Mr. Esaheb regarding the concerns I raised? And what was the conclusion of that conversation?
Changes. There are no other changes, and I think he had not seen the latest version because he doesn't have access to the amendments. So he got the amendments,
and
I have not heard back. He got them this morning. He sent us the stuff he had sent previously. I think most of his issues are addressed.
Okay, I'll try to give him a call. In the meantime, I'll hold back on.
But what
I'll
he said
abstain
is
in the
not,
meantime.
right, it's
Thank
not
you.
amending anything further.
Is there any further discussion on the amendments? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. To the amendments. All right. Do we have a motion on the bill? It's been moved and seconded. Is there further discussion on the bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. I've got Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. Delegate Taveras, did you want to abstain for now, or would you like us to move this later in the calendar?
I'm reading his response.
Okay, all right, so we'll record you as abstain from this vote. Who does not want to be on this bill? Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley, Delegate Taveras. We will also, while you're finding information, we will not record you on this bill. All right, House Bill 698. This is State Board of Morticians and Funeral Directors, et cetera, Lindsay Ann Rosenberg.
This bill gives regulatory oversight of crematories and reduction facilities exclusively to the Board of Morticians, removing the role that the Office of Cemetery Oversight has over those facilities. A person who holds a permit or registration from the Office of Cemetery Oversight may continue to operate under the permit or registration until it expires, and then they have to renew with the board. The OCO also retains jurisdiction over complaints and any individuals cited in those complaints regarding crematories and reduction facilities filed with the office before October 1st, 2026. There are amendments in your packet beginning on page 10 of the bill that conform the bill to the amendments adopted in the Senate on the bill, with 2 exceptions. The first is a clarification that current law right now authorizes disciplinary action for improper handling of human remains and failing to get permission of a court order before embalming or artificially preserving, and that is being changed to or. And then there was also a provision in current law that says that a reduction operator had to notify the authorizing agent in writing and before initiating natural organic reduction that a person who uses or disposes of soil remains is in violation of 5.514 of the Health General Article, which is the provision about properly disposing of those remains. So rather, that's going to say is subject to that. They have to properly dispose of them. They are not just necessarily in violation because they accept those remains. There is also in your packet on page 21, this was not discussed in subcommittee, but there were floor amendments offered on the Senate cross-file, Senate Bill 413, by Senator Simonaire to correct cross-references that were made incorrect by the transfer of these provisions in this bill. So I've included that in this packet, so we'll make sure to include those in the committee amendments as well.
Delegate Rosenberg.
So the bill is now in conformity with the Senate. This is an issue that we dealt with last year, and we passed legislation, and the Senate did not pass our bill. Obviously, if we're conforming here, that would be the case. The bill would move forward.
Just to clarify, we are mostly conforming, is that correct? Because we have
With
the
the two
two
technical
technical amendments. And
Correct.
and so we'll, if you would like to move the amendments, we'll also consider the floor amendment separate, since that hasn't been heard by the subcommittee.
So move the conforming amendments and the two technical amendments.
All right. They've been moved and seconded. Any further discussion on the amendments? Seeing none, all in favor say aye. Oh, Delegate Alston.
Yep, I thought when we were in subcommittee, we were going to intentionally send over something that didn't conform to the Senate so we could have time to work out our differences and hear from the funeral directors. And I thought that the amendments we were offering in subcommittee were designed to do that.
The amendments are slightly different from the Senate's amendments. Those two technical corrections that I described are different. The Senate did not adopt those.
Okay, I just wanted to be sure because we said we were conforming to the Senate. Okay.
Yes, we are mostly conforming.
Okay, thank you.
To changes and so any further discussion on the amendments that were considered by the subcommittee? All in favor say aye. Anyone opposed, go ahead and raise your hand. Now, there was a floor amendment that was offered, so would somebody like to move that amendment?
Move the floor amendment.
All right. Is there further discussion on the amendment as described by Lindsay? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right. Is there a motion on the bill as amended? All right, it's been moved and seconded. Any further discussion on the bill as amended? Delegate Szeliga.
Thank you. I would like to see a reprint. This is a lot of moving parts, and part of this bill, I believe that we're considering, has portions that were never heard in bill hearing. Part of this is from last year's bill. Was that put in there?
Clarify, the Senate did not include those amendments, and the subcommittee also did not opt to include those. Delegate Bhandari had expressed a desire to include provisions from last year's bill in this year's bill, and the subcommittee did not move forward with those.
Okay. Well, I would like to see a reprint. This bill seems completely different than what it was. And, this is a really important issue. We had a really horrible thing happen last year with the bodies that were not cremated and families that didn't get their remains back. And we didn't do anything. Nothing passed. And so here we worked. I was on a work group with the speaker put together. We tried. Now we're back here, with this bill, which I can't tell you if it's good or bad. It's hard to follow what's going on. This is important. Our people in this state count on funeral directors, count on funeral homes to help when their loved one passes away. And it's also small businesses. These are family-owned small businesses
Would you
that
like
are
to hold the bill?
running these. So I'm going to vote against it. I want to see a reprint. I can't vote for something that I don't know what it is.
Delegate Szeliga, would you like to hold the bill till the next
Yes,
voting
I
session?
mean, if you'll let, it's not generally accepted, so I can do math.
We have the time. You are correct. This is a really important issue. And we have the time. So we will hold the bill till the next voting session so that we can get a reprint out to the full committee.
Yeah, it'd be nice for the full committee and the advocates, the board. We didn't even hear from, the board hadn't even seen this on the last subcommittee call, and the professional association hadn't seen it. So you know, Lindsay's done a lot of work on this. I'd love to get that information to both of them as well. So when we meet again, we can hear from the experts.
No, that's fine. We're going to hold it. I do want to clarify, though, that the board did see the Senate version because we did not adopt the amendments that were proposed by the House sponsor. So, but we will hold the bill. We will get a reprint out to everyone because we have the time and we want to make sure that we get that right because it was very traumatizing last year. The next 4 bills we are second on. So we've got House Bill 892, 893, 925, and 1120. So we'll start with 892, which is business regulation, cemeteries, actions for sale, transfer, or alternate use. This is Lindsay.
So this bill alters requirements relating to a court action that may be brought for the sale of a burial ground for another purpose. The amendments that were adopted unanimously in ECM strike language relating to structures used to conduct business related to the operation of a cemetery from the definition of cemetery, requires a court to make a determination on disposition of the property within 6 months, and states that provisions do not apply to property acquired by the Department of Transportation necessary for a public project.
And do we have,
Members who went were Kippy, Ross, and Kaufman, and Delegate Hill's the sponsor.
do we have a motion on the bill? All right. It's been moved and seconded. Is there any further discussion on this bill?
Unanimous.
Seeing no further discussion, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, House Bill 893. This is business regulation, abandoned cemeteries, acquisition and disposition. This is Lindsay.
This bill authorizes a governmental unit to bring a condemnation proceeding to acquire property on which an abandoned cemetery is located with the intent to transfer the property to certain individuals or organizations to maintain and preserve the cemetery. The amendments adopted again unanimously in ECM require a court to make a determination on disposition of the property within 6 months and adds veterans organizations to the bill for the list of organizations that the governmental unit could transfer them to.
Is there a motion on this bill?
Move the bill.
All right. It's been moved and seconded. Is there any further discussion? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, thank you very much. House Bill 925. This is sewage sludge, per and polyfluoroalkyl, we know what it is, substances regulation, Chris and Hill, but we're second on this one. So
As amended, the bill establishes prohibitions and restrictions related to land application of sewage sludge that has a total concentration of regulated PFAS equal to or greater than specified levels. The bill establishes related requirements for the Department of Environment and sewage sludge generators. In addition, the bill establishes provisions related to the establishment of pretreatment standards or discharge permits for certain industrial users of public wastewater systems. The amendments add co-sponsors, make technical changes. Amendment number 2 delays the date on which the bill's land application restrictions take effect to October 1st, 2028. The amendment also clarifies rules around commingling of sewage sludge, extends the timeline for implementing certain mitigation plans, alters rules around testing for PFAS, and alters requirements regarding assistance to publicly owned treatment works that do not have industrial pretreatment programs.
do we have a motion on this bill? All right, it's been moved and seconded. Do we have discussion on the bill? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right. Last one that we are second on is House Bill 1120. This is professional licensing, portability, members of the Foreign Service and spouses. This is Lindsay.
This bill authorizes a foreign service member or foreign service member's spouse who relocates to the state due to an assignment or detail to the state and holds a license issued by another state to practice under that license for the duration of the assignment or detail in Maryland if the individual provides specified documentations and satisfies other criteria. The amendments adopted unanimously in ECM conform the bill to the Senate bill and add co-sponsors. The relevant provisions in the health occupations article had language that would allow somebody who's authorized rather than licensed, like authorized to practice, to supervise like lower tier people in that, under that regulatory board, and that language has been struck throughout the health occupations article so that you would, the existing supervision requirements would continue to apply.
Do we have a motion on this bill? Move the bill. All right, it's been moved and seconded. Is there any further discussion? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right. We will send the message over to them. House Bill 1135. This is Health Occupations Pharmacist Vaccination Orders. This is Lindsay Ann Rosenberg.
This bill authorizes a pharmacist to order a vaccine for an individual who's at least 3 years old without the pharmacist administering the vaccine. The amendments adopted in subcommittee are on page 24 in packet 1. The amendments alter the reference to administration by an adult caregiver to be by a parent or guardian and apply the bill to vaccines that are for intranasal administration.
Delegate Rosenberg.
Key amendments here, we're limiting the authorization to a parent or guardian, not just any caregiver, and also that it can be used for anything nasal. Move the amendments.
All right, amendments have been moved and seconded. Is there further discussion on the amendments? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. On the bill as amended. All right, it's been moved and seconded. Is there further discussion on the bill as amended? Delegate Kipke.
Did I hear correctly in the amendments that it's limited to the parents or guardians? Yes. So it can't be like a babysitter? Yes. Oh, that's good. Thank you. And then, one last question. Sorry, it just dawned on me. I'm very comfortable with it for something like flu mist, but could I have better understanding of what category, what else could this be in the future?
The list is a vaccine for influenza, COVID-19, or used in response to a public health emergency.
Thank you.
And still limited to for intranasal administration.
Delegate Shalega.
Thank you. I'd probably want to let Delegate Kipke know they didn't resolve the ImmuneNet, who's going to record it. So children who live in households that, with a mom and a dad that are in separate households, that could be complications. And I'd never heard anything about the disposal of if it's medical waste, how do you dispose of it? Who's supposed to take care of it? So I'm still worried about the chain of custody. Thank you.
Delegate Hill.
Thank you. That's an interesting question. So I think that ImmuneNet, the information for ImmuneNet is done at the site. You're saying that it's normally done with the dispenser. I would assume that the pharmacist, when they prescribe it, would have to file with ImmuneNet that they have prescribed it for this particular person. And that's how that would go. And they got some information that for some reason it wasn't given, but it would be presumed that it had been administered. And as far as disposal, at this point we have a significant amount of medical waste, diabetic needles, GLP-1 needles and injections, asthma medication. So a flu mist injection, and there are some that are being used now, that just goes in the regular home waste like anything else does. So I don't think it raises any particular issues particularly because there are no sharps involved.
Is there any further discussion? Seeing none, we are on the bill as amended, correct? Yes. Okay, keep me honest. All in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Delegate Shalega? Delegate Riley? All right. Oh, Delegate Morgan. That's why I always come back. I want to make sure I record it accordingly. Who does not, Delegate Hutchinson.
He's against it.
All right, Delegate Kipke. Who does not want to be on this bill? Delegate Shalega, Delegate Morgan, Delegate Hutchinson, Delegate Riley. Delegate Kipke, do you want to be on this bill? You're voting, okay, just double checking,
Five opposed.
It's definitely better.
Yep. Yep. All right, we're going to take the vote again, just so I'm getting everything accurate. All right, on the bill as amended, it's been moved and seconded. All in favor, say aye. Aye. Anyone opposed? Go ahead and raise your hand and take my time. Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. And who does not want to be on the bill? Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Riley, Delegate Hutchinson, you do not want to be on this bill, correct? All right. Hey, I strive for accuracy. House Bill 1150, this is Health Occupations, Pharmacists, Minor Conditions, and HIV Prevention and Treatment. This is Lindsay Ann Rosenberg.
This bill authorizes a pharmacist to order a test for, screen for, and treat certain minor conditions in accordance with a statewide written protocol established by the Board of Pharmacy. The bill repeals the non-occupational post-exposure prophylaxis standing order program and instead authorizes MDH to establish a statewide written protocol for the delivery of pre-exposure and post-exposure prophylaxis medications for the prevention and treatment of HIV. The amendments that begin on page 25 in your packet, adopted in subcommittee, strike language relating to what drugs or devices a pharmacist may prescribe in favor of a specific list of conditions listed in the bill, strikes specific conditions for which a pharmacist may order for a test for, screen for, and treat, and strikes language authorizing a pharmacist to delegate the administrative and technical tasks of performing a test to a pharmacy student or individual in a pharmacy technician training program, but adds a registered pharmacy intern.
Delegate Rosenberg.
Favorable.
All right, it's been moved and seconded on the amendments, correct?
Yes.
Okay, on the amendments have been moved and seconded. Now, is there any further discussion on the amendments? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. On the bill as amended. All right, it's been moved and seconded. So we'll open up for discussion. Delegate Kipke, followed by Delegate Alston.
Thank you. So when I'm looking through the testimony, recognizing that it doesn't take into account the amendments, one of the oppositional testimonies states that this would allow pharmacists to treat for pregnancy and prescribe abortion drugs without a doctor's examination. Is that true? Okay. And then there's opposition from Patient First. I guess instead of going through each one, do we know if the amendments eradicated the opposition from the American Academy of Dermatology, Patient First, Association of Nurse Practitioners, MedChi, and one or two others?
I can't speak specifically to each one of those. I assume the dermatologists were concerned about the skin conditions, which was struck. But I do know that the sponsor worked with advocates and the board on this specific list of conditions that ended up in the bill.
And could you just say what's left in the bill?
We've got, so it's minor conditions including Group A streptococcus pharyngitis, influenza, COVID-19, and other respiratory illnesses, conditions, or diseases, athlete's foot, and other emerging and existing public health threats identified by the department if authorized by an order, a rule, or a regulation. And just to clarify, this is all subject to the statewide written protocol established by the Board of Pharmacy.
Okay. I'm going to vote against it. I may change it on the floor. I don't know, could we get an email with the reprint, or do you have it, or is that easy to do?
I was trying to save pages, I apologize.
It's okay. No, I don't know who else would care to see it, but I'd like to see the reprint. Thank you.
Oh. Delegate Shalega.
So does Lindsay, a pharmacist may order tests for, because I think where Delegate Kipke's going, that some of the medical professionals were concerned about pharmacists testing for strep throat and UTIs. Is the UTI still in there? That was 7. Strep and UTI are still in there. Okay. UTI is not in there. Strep is in there. Okay. Thank you.
Is there any further discussion on the bill?
Just ask counsel,
Delegate Rosen.
did I hear you correctly that there was testimony that the bill as introduced would permit abortion procedure or medicine to be authorized, and that is not the case in the bill as introduced? So it was incorrect testimony. Thank you.
Any further discussion? Nope. All right, we are on the bill as amended. All in favor, say aye. Aye. Anyone opposed, go ahead and raise your hand. Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. Who does not want to be on this bill? Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. All right, thank you very much. House Bill 1249, this is certified recovery residencies, refusing services to individuals receiving medication-assisted treatment prohibition. This is Lindsay and Gazzoni.
This bill specifies that the requirements established by a credentialing entity for certified recovery residences must prohibit a recovery residence from 1, refusing services to an individual based on the individual receiving medication-assisted treatment for opioid use disorder, and 2nd, requiring an individual to cease or modify how the individual receives medication-assisted treatment for opioid use disorder before the individual may receive services at the recovery residence. No amendments from subcommittee.
Delegate Gazzoni.
This was a party line vote in subcommittee. Move the amendments.
Second.
Oh, sorry, yes, move the bill, because there's no amendments, sorry.
All right, the bill has been moved and seconded. Is there further discussion on the bill? Delegate Kipke.
Thank you. I'm going to oppose the bill because I have concerns that there are productive treatment providers in Maryland who are abstinence-based programs. And I know that's, some people just hate that and don't think it is of the highest standard of care. But it works for some people. And a quick search of these facilities in the state of Maryland, they do a lot of really good work. And I'm concerned that we may be going a little too far with this. I don't think it's necessarily legislation that is needed to improve access to care. Most places accept individuals medically. I mean, if I were in that state, I think I'd be one of them, you know, like I'm not against it in any way at all, but for people who want to try an abstinence-based approach, many of them are faith-based organizations. You know, I just don't think this is necessary, so I'll be opposing it.
Any further discussion on the bill? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. All right, and there are no amendments. House Bill 1284, this is residential service agencies, private duty nursing, on-site nurse training programs. This is Lindsay and Gazzoni.
This bill requires MDH to adopt regulations that authorize a residential service agency to provide training to a specified licensed nurse after hire. An RSA that provides private duty nursing services may employ a licensed nurse who does not meet clinical experience requirements if the RSA provides specified training and a competency evaluation. A training program and competency evaluation are subject to approval by MDH, and there are no amendments.
Delegate Gazzoni.
So a party line vote. And on this one, I do move the amendments. No, I don't, because there's still no amendments. Lucky me.
I don't think it was a part.
Do you want to move the bill? I do. Oh, all right, it's been moved and seconded. We'll open it up for discussion. Delegate Kipke.
Yeah, I did have some concerns, but they may have been resolved. I just want to verify, this bill is about Medicaid, I think. Is that true? And does private payers already pay for this? The reason I ask is that's testimony that I read, and if that's true, I have a lot more comfort with it. So does this bill remove a prohibition on Medicaid in using entry-level, or whatever we call it, private duty nurses?
Level, so just as a point of reference.
Yeah.
I don't know the balance, but yes, some of these would be people that get Medicaid, yes.
No, am I reading the bill correctly that this bill will now allow Medicaid to pay these individuals as long as they follow the rules of the training and whatever the department outlines, where it's already being paid by private payers like Care First and others? That's testimony that I read that made me feel more comfortable about it.
The fiscal note doesn't speak to any Medicaid expenditures with the exception of the cost for the staff, which is just to,
But my sense is that it doesn't change anything with regard to the insurance that the individual already has. So if they already are covered by Medicaid, then that would continue in this instance. And if they just have private insurance, then it's private insurance.
And just to clarify, I mean, the bill is just allowing these folks to work in the facility before they've, while they're getting their training. So it's really more of a staffing issue, like the person in the facility is getting the services that they would get, sort of regardless of who's providing those services, right?
Okay. Thank you.
Delegate Riley.
Thank you, Madam Chair. Yeah, I remember, I wrote down from the hearing that, that Medicaid, currently under Medicaid insurance, that people to be covered have to have 1 year of pediatric clinical experience required before you can get Medicaid insurance. So these people do not have that qualification, so is there going to be a problem with them getting paid under Medicaid?
Sorry, thank you. Yep. Yeah, there are a number of other states where the regulations are written such that it does not run into that problem, and the changes that this does will be fine.
Okay, thank you.
Delegate Shalega.
Thank you. Yeah, I did some more homework on this, and I am not going to vote. I'm going to vote yes on the bill. So my concerns on this have been addressed. Thank you.
Thank you very much. Is there any further discussion on this bill?
Oh, Delegate Riley.
So there was opposition of the Board of Nursing, and then also Maryland Department of Health. Have they changed with the amendments?
Which I,
Okay, oh, that's right.
if I just looked at my piece of paper,
so
that's
so they're
okay.
still in opposition.
I know, I have spoken with the Department of Health, and they are fine moving forward with this bill.
They're fine. Okay, thank you.
You're welcome.
I believe that's correct. And I think that might be a philosophical difference of opinion on that one. So we are on the bill. Seeing no further discussion, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, that passes unanimously. We are now on House Bill 1434. Thank you for the discussion. What was that? Oh, yeah, no amendments. Yeah, sorry, no co-sponsors on that one. 1434, this is Maryland Department of Health Caregiver Resource Webpage Establishment. This was Chris N. Hill.
This bill requires the Maryland Department of Health to develop and maintain a centralized caregiver resource webpage for caregivers in the state. In developing the webpage, MDH must coordinate with the State Department of Education, the Department of Aging, DDA, and any other relevant state or local agencies. MDH must review and update the webpage as necessary, but not less than annually. There were no amendments.
The bill's been moved and seconded. Is there any further discussion? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley.
I'd like to just explain my vote. very fond of the sponsor of the bill. And, you know, it's similar to the Alzheimer's website bill last year. I did a simple Google, Caregiver Resources Maryland, lots of websites. You know, one in Baltimore County has a phone number you can call, which I think is even better. So not that I don't care about caregiver resources, but I, you know, think there are adequate resources today as we face a massive budget deficit and a $71 billion budget. So thank you for your work. It's, you know, not personal. Thank you.
Thank you for your comments. So we did take the vote on that, and Delegate Martinez.
Yes, thank you. I just want to also thank the bill sponsor for the bill. You know, one of the things I hear often from residents when I'm back home is that they need more support. They need more just authority from the health department on kind of how to locate resources. And I think these types of websites, these types of resource pages really give people a start. And I'm really appreciative that we're doing this because I'm often hearing from folks that are new caregivers or longtime caregivers that there just isn't a space to get resources. And so I'm really excited to see how many more families are going to be served because of this.
Thank you very much. Is there any further comments? All right. And we did take the vote, so thank you, everyone. We are now on House Bill 1483, Clinical Professional Counseling, Out-of-State Providers, Use of Telehealth for Continuity of Care. This is Lindsay Ann Rosenberg.
This bill repeals the State Board of Professional Counselors and Therapists' authorization to issue a temporary telehealth license, and instead, the bill exempts certain individuals from licensing requirements under certain circumstances. Specifically, an individual licensed and in good standing in another state may provide counseling through telehealth to a client in Maryland for the purpose of providing continuity of care for up to 6 months after the client relocated to Maryland or returned to Maryland after a continuous and non-incidental period of relocation outside the state. The individual must have an established client-counselor relationship with a client while the client was outside the state and must be no longer able to provide in-person counseling to the client because the client is located in Maryland. The amendments on page 26 in packet 1 apply the same provisions to social workers.
Delegate Rosenberg.
The subcommittee felt that this was consistent with the expansion of telehealth that we have done over the last half a dozen years, and I would move favorable on the amendments.
All right, amendments have been moved and seconded. Is there discussion on the amendments? Delegate Riley.
I did vote for this in subcommittee and still would like to vote for it, but as we leave, you know, I'm thinking, oh, shoot, I meant to ask that question, but I did not. So the question would be with the insurance. So they're coming, they lived in one state, the physician is licensed in that state, say Pennsylvania, I'm just picking a state, Pennsylvania. The person's moving to Maryland, so now they reside in Maryland for 6 months, have a new address. How will they can they get their insurance? And then if they get a job and they change insurances, will her insurance be paid by the Pennsylvania physician?
The coverage would move with the person. And now, even if it was a smaller company, it would move with the person. So if the person moved to Maryland, the coverage that they had in Pennsylvania would still cover them. And if the person changed insurance companies, it's a limited amount of time, it's 6 months, and I believe they would still pay.
Even if that physician is not licensed in the state of Maryland, but yet the patient lives in Maryland?
But they're licensed in the state where they work, so they have a license.
Okay, so you're saying they still work in the state that they're being seen at?
Correct. So as long as they have a license, then. In good standing, then they would be paid.
So their place of employment has not changed where the physician is treating them, it's just their location of where they live?
And it would only be for 6 months. So,
Okay,
yeah.
all right, thank you.
Thank you.
Is there, so we're on the amendments. Any further discussion on the amendments? Seeing none, all in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand. On the bill as amended.
Move the bill.
All right, it's been moved and seconded. Is there any further discussion on the bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. And this does have amendments, so who does not want to be on this bill? All right, we are all on the bill. House Bill 1593, this is Developmental Disabilities Administration Self-Directed Services Manual Public Comment. This is Chris Andhill.
As originally drafted, the bill required the Deputy Secretary of Developmental Disabilities to provide notice to the public before making changes to the Self-Directed Services Manual developed by DDA. The amendments make technical changes and amend the new provisions to instead require the Secretary of Health to adopt regulations that include self-directed services.
Delegate Hill, do you want me to pinch hit on this one because it didn't go to subcommittee? Yeah. So I will explain. This is the bill that we heard the other day. The amendment came from the Department of Health, which basically, instead of the 90-day process that was articulated in the bill, it actually put it under a regulatory process, which already has a 45-day period of review with a mandatory 30-day period of public comment, and it also subjects it to the AELR. So we felt that was an appropriate path because it also holds the department accountable and makes it less likely that they're going to regularly change the manual without public comment because they'll have to go through the regulatory review process every time they make a change and notify the public. So we felt that was an appropriate way to ensure that that manual wasn't being changed without knowledge of the people that were relying on the information. All right, the amendments have been moved and seconded. Is there any further discussion on the amendments? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. All right, on the bill as amended.
Move the bill. Second.
All right, the bill's been moved and seconded. Any further discussion on the bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Who does not want to be on this bill? Delegate Shalega. All right. Thank you very much. We are now on House Bill 1617. This is Public Health Innovation Zones Establishment. This is Chris Andhill.
This bill authorizes the local zoning authority of a county to designate a health innovation zone. However, Prince George's County must designate a health innovation zone in the Blue Line Corridor and the area located within 2 miles of the border between the county and the District of Columbia. When a health innovation zone is designated, the county must establish by law incentives that will be provided to specified businesses that are located in the health innovation zone. A grocery store, pharmacy, primary care provider, and specialty care provider located in the zone are not subject to local zoning or land use laws. As originally drafted, the bill had a mandated appropriation of $5 million to Medco to provide for funding for the establishment of specified businesses in the zone, but only for those established in Prince George's County. The amendment removes the mandated appropriation and makes it discretionary, subject to the limitations of the state budget.
Delegate Hill.
Removed. It passed, I think it was 6-2.
All right, amendments have been moved and seconded. Is there further discussion on the amendments? Seeing none, all in favor say aye. Aye. Oh, on the amendment? Okay. Delegate Tavares.
No, thank you. Thank you for this bill, and I think it does a lot. I just want to make sure that if I could ask council, I see here that this is simply restricting to the Blue Line Corridor, but it also states that it's 2 miles from the border between Prince George's and the District of Columbia. Correct? But it must be those two. Because my concern is that there are areas that have a high level of substance use disorders, and there's a high level of I would like it for it to be also in areas where there is low pedestrian deaths. Low pedestrian deaths, because the main corridors, the state highways in Prince George's County have some of the highest pedestrian deaths, right? In my particular area, we have the highest in the tri-state area. I just want to make sure that we're just in an area where it is a food desert. It meets all the needs that Delegate Alston needs. You know what I mean? Because we do want to build exactly what she wants there. But I also want to make sure that we're protecting from folks that have, not exposing them to individuals that have substance use disorders.
So,
This is pedestrian or high pedestrian?
This is a statewide bill.
He's talking about the specific Prince George's County.
Is it not? Is it not in my? But you see, are you looking also down on there?
Let me go to Delegate Alston and then to Delegate Hill.
Yes, please.
Thank you. So the bill as drafted authorizes the county council to create the zones wherever those local councils deem it's appropriate. So
Okay.
this will give them the flexibility to designate a zone, say in Langley Park. But it requires them to designate a zone at the Blue Line corridor and within 2 miles of the DC border, because that's where we have some of the greatest problems. So Langley Park might actually fall within the 2 miles, I'm not sure. Parts of the area you're describing may fall within 2 miles of the DC border, but I would suggest that we can work with the council to make sure the areas that you're concerned about are incorporated when they get the authorization to do this work.
Or I mean, or have them be excluded, because that strip right there is the most dangerous with the highest level of pedestrian deaths.
Well, then the council probably wouldn't put it there, because that
Well,
strip
that's what I-
has a
that's what
lot
I
of
would
the
hope.
stuff that's needed, and there's no room to put anything else there anyway.
Well,
So, yeah. Your concern should be addressed because it doesn't require it at that location, and it's authorizing the county. You're welcome.
Is there any further discussion on, Delegate Martinez?
As the other Prince Georgian on the committee, I just want to make sure, this is just enabling, right? That's right. Thank you.
Yes. The blue line,
But I mean, for the rest of the county, not
the
just
rest
the
of the
purple,
county, it's
not, excuse me,
enabling.
not Purple Line, that's my district. Blue Line, yes, is saying we have to do something because we need to spur growth around, particularly the stations that are near the DC line, because a lot of the investment, unfortunately, is not coming there initially. And so I do agree with the efforts of the delegate, so thank you.
thank you both.
Delegate Morgan?
Thank you. Is the part about the grocery stores and stuff, starting on page 4, like line 9, oh, is that stuff still in the bill?
Yes.
Okay.
Yeah, we're on the amendments. Yeah, yeah. Oh, okay. Just checking. That's okay. So we're on the amendments. All in favor of the amendments, say aye. Aye. Anyone opposed, go ahead and raise your hand. On the bill as amended. All right, the bill's been moved and seconded. Is there further discussion on the bill as amended? Seeing none, all in favor say aye. Aye. Anyone opposed, go ahead and raise your hand. Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. Who does not want to be on this bill? Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Hutchinson, Delegate Riley. All right. Last bill. Okay, House Bill 1625, Public Health Newborn Screening Program Fees and Core Conditions. This is Lindsay and White Holland.
This This bill increases the limit on fees for which the Department of Health must set for newborn screening, so that rather than not exceed amount sufficient to cover costs, it's changed to not less than the amount to cover costs. The bill also alters responsibilities for the State Advisory Council on Hereditary and Congenital Disorders regarding newborn screening, authorizes MDH to delay or not implement screenings for certain conditions after advice from the Advisory Council, and alters reporting requirements for MDH related to delays or lack of implementation of certain tests. The amendments on the last page of Packet 1 alter the date as of which the department shall screen for core conditions listed in the recommended uniform screening panel to be as of January 1st, 2026, rather than May 31st, 2026.
Delegate White-Hall.
Thank you, Madam Chair. The vote in subcommittee was not unanimous, and there was no discussion. I move the amendments.
All right, the amendments have been moved and seconded. Is there further discussion on the amendments? Seeing none, all in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand. On the bill as amended. All right, it's been moved and seconded. Is there further discussion on the bill as amended? Delegate Chalet.
Thank you. I'd like Delegate Hill to tell us about the bill because she's on the Rare Disease Advisory Council, and I think they were opposed to the bill.
Delegate Hill.
Yeah, they weren't opposed to the bill.
No?
No. They did offer that we should move as council stated, that we should move the date up to once we're referencing, because to January instead of, I think we had it in May. And that was because the advisory group no longer exists at the federal level. And so they thought that we should date it to when there was actually an advisory group.
And how about all the negative testimony from families?
This bill, so there seemed to be concern, particularly for the Crab Bays folks, that this would somehow allow the secretary to remove things from
I think it
the
says it
current
on the
list.
bill,
But
doesn't it?
no, it doesn't. The bill, there's nothing about removing. It says that going forward, she can make a decision. So a couple of years ago, when the Crab Bays bill came, we not only said that Crab Bays should be put on, we said that anytime something's put on the RUSP, the secretary has 18 months to put it on or explain why not. Actually, no, she couldn't even explain why not. She has 18 months to put it on or explain what the delay was. But there was no choice to say this doesn't work for Maryland or this is not a good idea or here is too expensive or anything like that. It was, if they pass it, we have to put it on. That has created problems, one of which, as you've seen, is increasing numbers of legislators coming forward and saying, put mine on and put mine on and put mine on. And it takes away the ability of the secretary to rely on the expertise of the pediatricians and the other practitioners who are actually doing this stuff. So what this bill does is two things. It says that if they add it to the RUS, that triggers a review by the advisory council and an expectation that the secretary will then put it on. And if the secretary, based on the review, decides it's not a good idea, then she has to explain why she's not putting on. So it's more than there's a delay. She or he could actually say, I've been advised that this is not a good idea and here are the reasons why, okay? The second thing is that previously the mandate was that they could not charge for the test, which is paid by the insurers and Medicaid. They could not charge more than the actual cost to administer the test. They were falling short. So now they have to at least cover the cost because they weren't covering the cost. And some of these facilities were saying it's getting harder and harder to do these tests because it's costing us money.
And so they were allowed to charge, but they weren't charging.
The fee that was set was not covering cost.
And the fee wasn't to cover the cost. I thought you said the fee.
The cap on the fee was it couldn't be more than the cost, but that meant you could charge half the cost or a quarter of the cost or whatever. So that was an issue that came up when we started discussing putting legislature in to not be so rigidly tied that it doesn't matter whether it's a good idea or a bad idea. if they do it, we have to do it.
And it does say, decide not to implement testing.
Right, that's
So-
a new test. That
That's
has nothing to do with the tests that are on there now,
Okay.
right? So it doesn't say the secretary can now go backwards and remove from our screening things that have already been put on.
Okay,
It
so,
says she can decide not to implement new testing.
And if I may, they were asking for the additional time because one of the things that's been articulated to us is that with that 18-month review period and automatically adding them to the list of screenings, they didn't have time for the equipment, the testing to ramp up in preparation for universal screenings. So they wanted more time, not just for the review process, but also to acquire the equipment for the screenings.
And I think thank you, Madam Chair. I think that's the other piece that's been missing in the process. I think when people think you're adding it, it just means you're running a different chemistry, but it really does mean sometimes that there's new equipment that has to be procured and other things that have to be done. And so, on the council are not just pediatricians from Children's, pediatricians from Hopkins, folks from University of Maryland, but it's the lab people, the people who are running the labs, and other people as well who are literally the people day to day who are actually actualizing this stuff. They're the people who are talking about what they can and can't do, what happens and all that. The other thing, this was not part of your question, but the way they function, anybody can come to them and say, I would like you to think about adding this. And they will schedule a day for that case to be presented about whether they should do it or not. So the review process is not, there are some they do automatically, but anybody who says, here's a disease I think you ought to look at, they'll schedule it to be looked at.
so backtracking to the beginning, you said part of the problem is legislators put in bills to have different diseases because it's heartbreaking when you see a family especially with the child. Will this encourage them to do more of that? Because now the secretary can just say no?
I don't think so.
I mean,
I think so because what it says is it keeps it tied to the RUSP.
Okay.
It keeps it tied to the RUSP. And so previously, before what we did 2 years ago, if they added it to the RUSP, we might pay attention, we might not. Then we said if they add it to the RUSP, we must go ahead and do it. Now it's just saying if they add it to the RUSP, we've got to re-review and see if it makes sense. If you haven't looked at it in 5 years, you haven't looked at it in 5 months, something may have changed. We need to look at it again and make a decision and make a recommendation. And the secretary may or may not follow the recommendation, right? So the recommendation may be don't do it, and the secretary says, no, I think this is something we can afford to do, and I think we need to do it.
Okay, and perhaps when we get these bills, this committee should say to the legislators, why don't you just ask them to look
Right.
at it?
Well, and in fact, that's
Instead of passing another bill.
Right, with Delegate Solomon.
Not that I don't care, but I care, but how many bills can we pass?
What Delegate Solomon actually testified to, and in private conversations, the reason he was able to say, I came before the advisory council, is because he brought that to them.
Yes.
And the advocates had apparently had a conversation with the chair, and at some point they heard the chair say, they thought he was saying bring a bill, and I think what he was saying is bring it up or whatever. There seemed to be some miscommunication. So they went to bring a bill, and he was saying, just ask, and we can review it. But I haven't confirmed with him what was actually said.
Okay.
But what Delegate Solomon testified to is that, yeah, they're reviewing this, or they were scheduling this to be reviewed.
They're already
looking at it.
well into the review process.
Okay.
Yeah.
Is there a fiscal note for this?
Raise fees.
Okay, they're raising fees, but that's to recover cost of. Okay. All right, I would love to hear from whoever voted against it. Thank you.
All right, so we are on the bill as amended. Delegate Riley.
I did have a question. So one of my concerns was the fee. In this bill, it sounds like, I get it, MDH says that they're fine with this and they can, do this with their existing budget resources. but this does open it up to the fact that, well, I guess they already can, but they, specifically put it in here that to the extent that MDH opts to raise fees for newborn screening. So I think, probably, and since they had to put this in here, I think that's probably their intention. I don't want to say I can't say that, right? Their intention to raise fees. But anyway, it talks about the fee and very possibility of, raising the newborn screening fees, which then has a down spiral through insurance and everything, and Medicaid and state and federal funds. So all of those could increase and decrease, whichever the case may be. But do you think that this is a possibility that the newborn screening fees would go up?
I think they're going to go up because they're not covering the cost. So, and it wasn't MDH that asked, can you also make sure that they should say that it has to at least cover the cost? Now, I mean, we could say that it has to cover the cost and can't be any more than the cost. I mean, right now it says it's capped at, but that's sort of silly. I mean, I think the main thing is they were saying, and these were the members who many of them, there are lay people on there too, but many of the members are the actual physicians who are doing the work. And what they were saying is with the equipment cost, with the cost that's gone up with reagents and all that, particularly as we have some problems with, what do we call it, the flow of chain
Chain of custody?
No.
Like the supply chain.
Supply chain, that chain, not that chain, that chain. That the fees are flat, and the costs are going up.
So Delegate, would you say that this just allows us to be a little more nimble as we identify screenings that make sense as the RUSP adds them, but it gives us the time and the flexibility to be able to ramp up to.
I just see that, we've, through this legislature, we keep expanding Medicaid, and this is a new.
This is the same thing they've been covering. And if the fee goes up, the fee goes up because fees go up, just like your gasoline is over $4 now, right?
Because it does say the increase is going to go up as near 2027. But okay, thank you.
Delegate Shalega.
I agree with you, Delegate Hill, that we should cover the cost. I don't know if you would be open to an amendment on that page, lines 3 to 6 on page 3. The existing language establishing fees for newborn screenings in the amount that is sufficient to cover the cost. So then kind of, allaying the concerns, not fears, of, Delegate Riley and others that, look, newborn screening is important. We all support that. They should cover the cost, but nobody should be covering more than the cost.
I defer to the chair.
I mean, I think we're amenable to that. Are we comfortable voting on it conceptually? All right, it's been moved and seconded. Any further discussion? Seeing none, all in favor say aye. Aye. Anyone opposed? All right, it's been moved and seconded. Any further discussion on the bill as amended with the conceptual amendment? All in favor say aye. Aye. Anyone opposed? Go ahead and raise your hand. All right, who does not want to be on this bill? Delegate Kipke, Delegate Morgan, Delegate Shalega. All right, thank you very much.